My name is Courtney Fitzhugh, and I'm thankful for this opportunity to speak to you. I first became interested in sickle cell disease when I was in college, and my first opportunity to do research was after my first year in medical school. And I realized during that summer that I was more interested in clinical research than basic science research. I learned about the Medical Research Scholars Program at the NIH, where medical students can take off a year between their second and third year or their third and fourth year and do research. And I joined John Tisdale's lab. We were interested in developing a new curative approach for sickle cell disease with bone marrow transplantation. Traditionally, what had been done was that children were given high doses of chemotherapy in order to completely replace the patient's bone marrow with that of the donor. And we and others realized you didn't have to completely replace the patient's bone marrow, and instead you could create a mixture of donor and recipient cells and give them drugs that will re-educate the immune system in order to decrease the risk for graft rejection and graft versus host disease. I was also able to see patients, and I was able to write a protocol, so I had a really amazing year. Afterwards, I finished medical school. There's also a clinical electives program for senior medical and MD PhD students who are able to come to the NIH for 1 to 3 months in order to participate in electives at the NIH. After I finished residency, I decided I wanted to go back to the NIH, and I completed an adult hematology and pediatric and hematology and oncology fellowship, which was combined with Hopkins. And after 2 years of clinical training, I went back to John Tisdale's lab as a clinical fellow. And the bone marrow transplant program that had been started was very successful, but at the time it was only available for patients who had a complete sibling match. And the chance that a patient will have a match is only about 15%. So while the results were very encouraging, this approach was only available for about 15% of the patients. So I wanted to develop an approach that could be used in the haploidentical setting so that parents, children, and half-matched siblings could be donors, and you can increase the chance they'll have a donor from 15% to about 90%. So during that time as a fellow, I was able to write, well, first I went back to the mice, and based on those results, I wrote a clinical protocol and was able to lead that protocol as a fellow. And when that time ended, I decided to apply for the assistant clinical investigator position, where I was able to have my own lab. I had a small budget and I had 1 to 2 people working with me, but it was my own. And I continued that for 4 years until I applied for a tenure track position, which for me was the Lasker Clinical Research Scholar Program, which is a clinical tenure track position, but there's also an equivalent position for people who are interested in basic science research. That's the Statman Tenure Track Investigator. And with that position as a Lasker Scholar, I was able to hire either a senior scientist or a clinician who could run either the basic science or the clinical aspects of my lab. And then I also had my own research nurse. I have a clinical fellow. I have post-bacs and postdocs. I have also access to a statistician, protocol navigator, and data manager. So I have all the resources that I need to be successful at the NIH, and I've had a really wonderful time during my tenure at the NIH.